How do genotype and phenotype affect CF test results? Cystic fibrosis is a genetic condition that affects many aspects of health. Understanding how genotype and phenotype influence test results is key to diagnosis and management. The genotype refers to the specific mutations in the cystic fibrosis transmembrane conductance regulator gene, while the phenotype describes the observable characteristics and severity of the disease. The relationship between these two is complex and plays a crucial role in interpreting test results. First, let's talk about genotype. Cystic fibrosis is caused by mutations in the CFTR gene. There are many different mutations, and each can affect the CFTR protein function in unique ways. Some mutations are known to cause classic cystic fibrosis symptoms, while others may lead to milder or atypical forms of the disease. For example, individuals with severe mutations typically experience classic cystic fibrosis, which includes pancreatic insufficiency and higher sweat chloride levels. In contrast, those with milder mutations may have less severe symptoms and lower sweat chloride levels. Next, we have the phenotype, which reflects how the genotype shows up in real life. This includes the severity of symptoms and the results of biochemical tests. One important test is the sweat chloride test, which measures the concentration of chloride in sweat. High levels usually indicate cystic fibrosis, but some individuals with milder mutations might have normal or borderline results. This can complicate the diagnosis. For instance, a person with certain mutation combinations may show normal sweat chloride levels even if they have symptoms related to cystic fibrosis. When interpreting genetic testing and sweat tests, it is important to look at both together. Genetic testing can identify specific CFTR mutations, but it does not always predict how severe the disease will be. This is due to variable expressivity, meaning that the same mutation can lead to different clinical outcomes in different individuals. Sweat chloride tests provide evidence of CFTR dysfunction but can be normal in milder cases. In summary, the genotype determines the type and severity of CFTR dysfunction, shaping the phenotype, which in turn influences cystic fibrosis test results. Genetic testing reveals the types of mutations present but does not always predict individual outcomes precisely. Sweat tests reflected functional impairment but may be normal in mild cases. A comprehensive evaluation that combines genotype, phenotype, sweat chloride levels, and clinical presentation is essential for accurate diagnosis and management of cystic fibrosis. Always consult healthcare professionals for personalized medical advice.